Okay.
Yeah. I think my question is, though, 'cause this is a perfect view. Are we copy signing? That feels awkward.
Hmm. Yeah.
Uh-huh.
Yeah.
Uh-huh. Yeah. Depending on where we're at.
That works perfect, and we can't. I was saying we can't block the chairs. Yeah.
Yeah,
Okay.
yeah, yeah. And
So,
I know there's a camera.
yeah. I'm just.
We're just trying to make sure, because this is the Zoom camera.
Yes.
We want to make sure Zoom's accessible and TV's accessible.
Yeah.
Because they will not, that camera's not going to show up on Zoom.
So it will be not showing up on Zoom. It'll be showing up on the house live TV.
Could I see those cards again?
Yes.
Okay. Soon as you're seated, and they're working out their logistics.
I think that's how most people are going to be watching.
Okay, we're good.
Only if
Are we?
We know what's happening.
Okay. Are we good?
We're good. Let's roll.
Okay. She's blocking the camera. Okay. We have to get started. Okay, we're ready.
I got it.
The Committee on Insurance and Financial Services shall come to order. Mr. Clerk, would you please call the roll to establish a quorum?
Representatives Carter,
Present.
McFall,
Here.
Coleman, here, Stone,
Here.
Breen, Rogers,
Here.
Scott,
Here.
Young,
Here.
Fitzgerald,
Here.
Grant,
Here.
Harris,
Here.
Markkinen,
Here.
Bazat,
Here.
Aragona, Bruck, Nyer,
Here.
Smith.
Present.
Madam Chair, you have a quorum.
Thank you. And now we need a motion to adopt the minutes of October 12th, 2023. Oh, I see Rep. Fitzgerald adopts the minutes as printed. Hearing no objections, the minutes are adopted as printed. I'd like to take a minute to welcome our American Sign Language interpreters, April Davison and Bethany James, our ASL, and Annette Blow, our captioner. To my left and right are our caption screens. You can see them, okay? Thank you so much for being here today. First up on our agenda is testimony only on House Bill 4944 and 4963, introduced by Representatives Zorn and Steckloff, respectively. Joining our colleagues are Sydney Kraisman, Chair of the Advocacy Committee of Summer Camp Programs of Michigan Alexander Graham Bell Association for Deaf and Hard of Hearing. Tressa Sanders, a mother to a child with hearing loss. Dr. Samantha Castellote, an educational audiologist at Trenton's oral program for the deaf and hard of hearing. And joining us virtually is KT Magviglia Morgan, a member of the Michigan Coalition Legislation Committee and hearing loss advocate. Thank you all for coming. For the sake of time, we will have a limit on testimony to 20 minutes and no more than 5 minutes per member to follow up for questions. Members, if we're unable to get all of your questions answered, please feel free to reach out to my office or the stakeholders with your questions after the committee. Now, guests, please come forward, the ones that I named. The floor is yours. Please come up. Representative Zorn and Steckloff. I see Representative Steckloff there. Do we have enough seats?
Yeah.
Okay. Thank you.
Chairman and committee members, and thank you for taking up the hearing and testimony on House Bill 4944. Hearing loss is the third top public health issue. Oh, I'm sorry. Are we good now? Okay. Hearing loss is the third top public health issue in America, and one of the most frequently occurring birth defects in the United States. In Michigan, about 400 children are born in Michigan every year who either have hearing impairments or will require one before starting school. It is documented by the Michigan Department of Education that there are 2,700 students in Michigan that have hearing loss. Much like the loss of vision, hearing disabilities create a profound disadvantage for the development of our youth. Every early intervention of hearing aids for children significantly increases academic success and decreases long-term costs related to education and mental health services, saving our government upwards of $650,000 in lifetime support. However, unlike vision, where insurance companies offer vision coverage for children, some insurance companies do not offer hearing coverage, putting our children at a disadvantage. House Bill 4944 specifically provides coverage for the treatment of hearing loss and hearing devices, provides hearing coverage for up to 19 years of age, and provides up to $3,000 per hearing aid every 36 months. Insurance actuaries and underwriters estimate an increase between 10 and 17 cents for a monthly premium. House Bill 4944 provides the practical insurance coverage for school-aged children through their developmental years. I'd like to turn the testimony over to the good Representative Samantha Steckloff to explain her bill, which is tie-barred to House Bill 4944.
Thank you, Representative Zorn. Thank you, members of the committee and Chair Carter, for having us here today. My bill 4963 goes hand in hand with Representative Zorn's bill. House Bill 4963 seeks to protect the coverage of services related to hearing. It's also those wraparound services that we don't often think about immediately, but are very much important to take care of our folks who need things like this. So these include things like audiological examinations and services necessary to assess, select, and adjust or fit a hearing aid to ensure optimal performance. Hearing aid evaluations, programming, conformity evaluations, or even prescription verification measures, servicing, maintenance, and repairs. Remote microphones, ear molds and ear molds replacement, auditory training, speech-language habilitation by an audiologist or speech-language pathologist. These wraparound services are extremely important to long-term positive outcomes and are critical for cognitive and intellectual development, social and emotional development, social emotional health, educational development. And I know we're short on time today, so thank you so much for having us here today about these bills.
So welcome, please.
Hi, my name is Dr. Samantha Castellute. I am an educational audiologist for Trenton Public Schools, a oral program for the deaf and hard of hearing. I also have hearing loss myself. My sister and I were born at 27 weeks gestation in 1990. We were given a drug called gentamicin, which is an ototoxic drug and is believed to be the cause of my hearing loss. My hearing loss was not identified until the preschool hearing screenings at around 3.5 years of age. At that time, my parents did decide to move forward with hearing aids. I do want you to understand that over 90% of babies with hearing loss are born to hearing parents. Often, that baby may be the first deaf person that a parent may interact with. And so, naturally, these parents choose hearing aids or implants later to provide auditory access, which allows those parents to be natural language models for the development of listening and spoken language. So my parents were told when I was 3.5 that hearing aids were a comfort device and they were not covered under insurance. So my parents made the sacrifice to pay out of pocket multiple times over the course of my childhood for these hearing aids, and because of that, I stand before you as a doctor. I'm a doctor who works with these kids every day. Excuse me. And these bills will provide the necessary devices and services for these kids to access their home and school lives. Before I got hearing aids, My twin sister would speak for me. I would hide behind her, and I could not communicate without relying on others. My mom would always say that I would grab people's faces so I could read their lips and try to understand and communicate. 30 years later, despite mandated newborn hearing screenings and identifying kids early enough, it's because of this inadequate insurance access and coverage for pediatric hearing aids and hearing health care that children are still experiencing that lack of communication at home that I did 30 years ago. So those newborn hearing screenings have been mandated since 1994, and due to that, many babies are identified and diagnosed with hearing loss early enough. And if they are fit appropriately early enough, they can go on to develop normal speech and language. And so that results in them not needing special education services throughout their school years. I do believe that the fitting of adequate hearing aids is really the missing link in having these very successful, normal, typically developed outcomes for these kids with hearing loss. And having mandated insurance coverage will allow our kids to flourish in their communication, education, and truly grow into their true selves as I did. It's really critical that children hear all waking hours to develop listening and spoken language. When it comes to language development, we learn how to socially interact at home. So when we send kids home from school and they do not have personal hearing aids, they are missing out on very critically important language development skills. And, we also learn valuable incidental information at home as well. So by not covering pediatric hearing aids, insurance companies are truly robbing our children of learning and communication opportunities, possibly even an opportunity to be a successful doctor, an engineer, a politician, teachers, a UAW worker, whatever their dream might be. So please support House Bill 4944 and 4963.
My name is Tressa Sanders. Professionally, I serve as a corporate director of human resources for one of Michigan's fastest growing rehabilitation and adult assisted living facilities companies in Michigan. With an additional 20 years of experience in health insurance on the broker side, I'm well versed in the gaps that exist in our healthcare system. However, my most important role is being a mother to 3 extraordinary children. Today, I come before you to advocate on behalf of my youngest daughter, Gwendolyn, and numerous other children across Michigan who require your urgent attention. Gwen was born 8 years ago with immediate encountered difficulties with hearing. It took 3 long years in inclusive testing and subpar guidance before she was accurately diagnosed with significant bilateral hearing loss. By the time we received her hearing aids at 3 years and 9 months, her emotional and behavioral development had already suffered immensely. The challenges didn't end there. Gwen also required intensive speech-language pathology services multiple times a week, another expense that my family had to cover out of pocket. These services are not ancillary. They're essential for children like Gwendolyn to function and integrate into society. I wish to underline that this is not merely a personal family crisis, but a broad economic and communal issue that impacts Michigan at large. Children who experience delay in diagnosis will need additional educational support, which costs a district and county upwards of $17,000 per school year. For Gwendolyn, the cost is actually $55,000 per year, as a district could no longer provide education for her, as she is now in a specialized deaf hard of hearing program. Extended over the next 9 years, her education will cost the state of Michigan $4,955,000 per year, extending over the next 9 years of her full education time in Michigan. Outside of school, we have provided private speech therapy several times a week at the out-of-pocket cost of $250 per hour. Over the last 5 years, these services impacted us at well over $65,000 for my family alone, not including the hearing aids, which cost $3,000 per year every 3 years, and the molds, $250 per set, which in the first year we had to replace 7 times. For less than 10 cents per Michigander, we can fund these essential hearing services for children. This nominal investment is not just a moral obligation, but a fiscal responsibility choice that promises substantial long-term savings in both education and healthcare expenditures. Ladies and gentlemen, when citizens learn that these vital services are not covered in our state, the response is a universal shock. The time for action is now. I urge you to lend your unanimous support to the Let My Child Hear bill. This isn't a partisan issue, it's a Michigan issue that can be resolved for less than a dime per resident, therefore profoundly enhancing the quality of life for our children and communities. Thank you for your time and commitment, and thank you for serving the people of Michigan.
I'm Sidney Kreisman. Thank you. I'm Sidney Kreisman. I'm the advocacy chair of the Michigan Alexander Graham Bell Association for the Deaf and Hard of Hearing. I'm also the parent of a daughter who was born with a severe hearing loss in her left ear and a profound hearing loss in her right ear. Lisa just uses a hearing aid in her left ear. Her right ear is too profound to be able to benefit from a hearing aid. I'm an older guy. My daughter was born in the 1970s. If she was born now, we would have a cochlear implant on her right ear. She'd be wearing a hearing aid on her left ear. Without her hearing aid, she cannot hear spoken language. Hearing aids now cost $3,000 each. Many parents, whether they're working and have a low income or even in the middle income, just can't afford it. I've got a letter here from the president of the Michigan Alexander Graham Bell Association for the Deaf. That's Mr. Dan Serafinoff. He works for an engineering company. He's deaf. He wears 2 cochlear implants. I actually met him when he was a teenager. His sister was my daughter's teacher in the Deaf and Hard of Hearing program. And at that point, he had a severe to profound hearing impairment. He wore hearing aids, and he was an excellent lip reader. So he was using both the hearing aids and his lip reading ability. So it reads, to our representatives, this is from Dan. To our representatives, I want to share that I was fortunate to have parents who did purchase hearing aids for me when I was growing up as a child with hearing loss. My parents had to pay for them. We did not have any insurance coverage for them. I remember classmates in the deaf hard of hearing program when I was in school whose parents could not afford to purchase hearing aids for them. In the classroom, we did have FM units so they could hear the teacher, but did not have any hearing aids to wear at home. I would say that this is a tragedy because they're just not going to be able to develop their spoken language to the same level as typically hearing children, and they're going to fall further behind and be stuck in special education. This is Dan's writing again. This has been an issue for a very long time, and insurance companies view hearing aids as a luxury item. We have vision and dental coverage. These items are necessary for everyday life. Why are hearing aids not seen by the insurance company as a vital item for quality of life? I fully support this bill. Dan's working for his engineering firm right now, and he just can't be here. That's what he gave to me. The last item that I would mention is that requiring hearing aids for children is cost effective. And so there's a 4-page memo that I sent out last night. Actually, you haven't had a chance to read that yet, but it's got 3 studies in there. In addition to it, I cite and quote the CDC and the World Health Organization. They say that hearing aids are cost effective. If you think about it, it's pretty obvious. If the kid can't hear, then what are you going to do? I would point out that the one study out of Australia points out that all of the children who received early intervention, and that's a key on this, early intervention by 3 months of age who had hearing aids, if the kids needed the cochlear implant, they got the cochlear implant, but by age 5, all of the kids with just the hearing loss, regardless of how severe it was, didn't need special education anymore. They had the same language levels as typically developing children, and the speech for 96% of them was at the same level as is typically developing children. The U of M study that I cite in there is for cochlear implants, but it's the same, but it's astounding to me, actually, in that by age 7, with these children who used the listening and spoken language and the cochlear implants had the same language and articulation levels as typically developing children. It's something that is astounding to me when I think about how I had visited the classroom programs for the deaf and hard of hearing in the 1970s. At that point in time, there was no universal newborn hearing screening in the hospitals like there was. So the kids were being identified late. My girl was identified at 20 months of age. That's a huge disadvantage. The technology was not as good at that point in time. Dan points out that some of the kids didn't have hearing aids at home. I don't know how they're going to develop speech and language as a 1 or 2 year old, which is a critical time period, if they can't hear.
Excuse me, Mr. Kreisman, we have a heavy agenda today, so we need to wrap it up. No disrespect, but we have a lot of people.
Thank you for reminding me.
So welcome.
There's a savings of over $16,000 per child if they have hearing aids, and so I've got the studies that are in there. If you multiply that by 100 children who would otherwise have to go into special education when they start school at age 5, comes out to $1.6 million savings for the public schools. Thank you.
Thank you so much, Representative Zorn, Steckloff, all our presenters here today. We have additional people who are wishing to speak. We have questions for this panel. Representative Smith.
Thank you, Madam Chair, and thank you for, excuse me, all being here to give testimony on these bills. Excuse me. As a mother of a child who has profound hearing loss, I'm very familiar and aware of all of the challenges that come with that. A couple questions that I do have, if I may. So this doesn't really cover cochlear implants, is one thing. So this is just for hearing aids, I see. But for us, we have, our son was adopted and identified very late, at 19 months. That's considered very behind. And part of insurance to qualify for the cochlear implant, he had to have hearing aids first for a period of time to determine if they helped at all, which they did not because he was profoundly deaf. But we never had any trouble with insurance not covering that. So, when we had the testing done to determine the level of his deafness, before we left the hospital, we were given all of the insurance or paperwork for secondary insurance, children's special health care. So there was never, they picked up that gap. There was never a problem with insurance not covering the hearing aids per se. Now, we personally have had a lot of issues with, most recently, our insurance not covering his cochlear implant, which presents a real problem because he's 19 now. But can you answer that question of, I guess, what problem are we trying to solve when, I've lived through this for 19 years and we've had all that, his hearing aids at least covered.
I can answer that. Insurance is based on how your employer is privatized. It's not all the same. So it depends on if the insurance company offers it in their base plan, if it's a fully insured. If it's not, if it's a self-insured plan, the employer would have to select that as an add-on. It is not required for employers to select that as an add-on. If you work for a larger corporation, the big three, the automakers, they usually cover a portion of it. Majority of companies in the state of Michigan don't select that as an add-on. So what we're looking at is to make that part of not an add-on, but a requirement.
Okay, great. And then has there been any discussions about furthering that then to cochlear implants? Because that's
cochlear
a problem.
implants are actually, those are supposed to, because that's an implant into the body. So if you're having problems with that, that's something, another level, and I'd love to help you and discuss that because I can probably hook up with the right people to get that covered. That's an implant in your body and it's covered no matter what because it's actually a physical implant. They can't technically carve that out.
Okay, sorry, to clarify, his implants were covered, but the processors,
Yes.
which are $9,500 per processor, when you have two of them, that's a lot of money on the exterior of a young one's head.
Yep. So that would be part of, like you said, it aligns with the hearing aid portion of it. And yes, we were looking for this is our start of this process, and we'd love to take this further. We just want to start here and then amend the bill as we need to.
Thank you.
Representative Breen.
Thank you, Madam Chair. I'm sorry. I hope I didn't miss this. First of all, thank you for bringing this forward. My son, who was born with a cleft palate, we're very fortunate. A lot of other families aren't, as we visit the Mott Craniofacial Clinic and we see all the kids with these significant problems. My concern is that right now it looks like these bills are limited to people under the age of 19, yet children can be covered up to age 26 under the ACA. Is there any insight as to whether or not I have a legit concern here, or whether or not this is something that might be able to be rectified?
The reason we selected to do the 19, we brought this to the state back in 2011, I believe it was, and that was turned down for the age of 26. Again, we definitely would love to see it up to age 26. We just want to go ahead and get this passed, and then obviously, as your concerns are, we'd love to work with all of you and amend those bills and get what we need to really get covered as a whole.
Thank you.
Once again, thank you for your testimony. We have some additional people who are going to come up and testify, and I ask that they limit it to 2 to 3 minutes. Can we have Jared Adams? Can we have Tyler Smeltroth and Jerome Pride come up? Jerome Reed. Sorry about that. It says Pride. Thank you so much. Come up. The floor is yours as soon as you're seated.
You want to speak or no?
And also, we had
Teddy Dorsett.
Teddy Dorsett. Thank you so much. The floor is yours.
Good morning to the committee through the chair. I'm Jerome Reed, legislative liaison for the Michigan Department of Civil Rights. And I'd like to introduce Ms. Annie Uraski, who is the director of our department's Division of Deaf, Blind, and Hard of Hearing. Ms. Uraski.
Yes, hello. We're going to get our interpreter set up here.
All right. Hello. Good morning, everyone. We are pleased to be here today. Chair Carter and members of the House Insurance, Finance, and Services Committee. We are the Division on Deaf, Blind, and Hard of Hearing, and we are really focused on the rights and preserving effective communication for Michigan residents who identify as deaf, blind, and hard of hearing. These two bills are critical because it will have a direct impact on the young lives of Michigan residents who identify as deaf, blind, and hard of hearing, and on their parents. Hearing aid insurance coverage is essential for people who might rely on that tool. And that expense for hearing aids and audiological services is considerable. Most families can't afford that. Deaf, blind, and hard of hearing children should have all available resources and tools as they grow to help them develop in their lives, in education and employment. This legislation will also align for the state of Michigan, it will align Michigan with other states who have already passed similar legislation. Passing this bill will change lives for families and children and make sure that Michigan is welcoming and investing in these children and their futures. Michigan Department of Civil Rights and the Division on Deaf, Blind, and Hard of Hearing is in full support of this bill. Please reach out to us if you have any questions or need additional information. Thank you so much for your time.
Thank you. Anyone?
Good morning. My name is Jared Adams. I am a deaf and hard of hearing constituent of District 83. My representative is Fitzgerald. Thank you for listening to us today. I lost my hearing when I was 2 years old, and imagine being young parents trying to start a new family. You've graduated from school, you've maybe gone to college or trade schools, and you suddenly realize you have to foot a $5,000 to $12,000 bill for hearing aids alone, not covering audiological services. As stated before, many young couples cannot afford this. Luckily, my parents had the Shriners Club to fall back on, but we should not have to rely on other nonprofits to help out. I just wanted to voice my support for the bill. Thank you very much.
Thank you.
Hello, my name is Tyler Smeltercup. I am here in my capacity as Assistant Director for Assistive Technology Innovation at Michigan State University Resource Center for Persons with Disability. Our office is the place students with hearing loss turn to for accommodations and support. I am also here as a deaf man in support of Michigan deaf and hard of hearing community members. In Michigan, there has long been a gap for our children to have financial access to sufficiently accommodating high-quality digital hearing aids. Our children must be able to have access to hearing aids that are appropriate for their level of hearing loss to best ensure their future success as proud Michiganders. Sadly, our office at MSU regularly see incoming freshmen with hearing loss that have no audiological devices or assistive technology, having been stripped of the school district loaned equipment they became familiar with and relied on for over a decade. I cannot emphasize enough to you the massive impact that this has on our students during a critical time of adjustment and independence, a time when they should be thrilled to begin the next chapter of their lives. House Bill 4944 hearing aid would ensure that no longer do our students arrive to post-secondary education unfairly unequipped. They would arrive confident in their choice of device, if any, having had many years to experiment, explore, and decide on the most appropriate communication modality and technical support for themselves. I also strongly support House Bill 4963, hearing aid-related services and devices, as it extends the coverage for audiologists and physicians to make necessary reprogramming to the digital hearing aid so that they are most compatible with the individual child, as well as ensuring access to support that devices like remote microphones that are very effective in classroom setting. Our deaf and hard of hearing children are part of Michigan's future, and your support of House Bills 4944 and 4963 will help ensure the greatest possible chance they can achieve their goal, make their families proud, and show the next generation of deaf and hard of hearing children that their contributions are valued and that they matter. Thank you.
Thank you. One last one.
Hello, good afternoon. My name is Teddy Dorset III, and I'm a fourth-generation deaf person. I'm a nativer from Detroit. I have a bachelor's from the University of Michigan. I am also currently a filmmaker. I own multiple small businesses, and I'm currently serving on the board of 3 different organizations. I was appointed to the council for the Department of Deaf, Blind, and Hard of Hearing with Annie Uraski, Director Uraski here, and we're familiar, and Jared is also on the board. We're here today to, I'm also the president of the Coalition for Deaf, Blind, and Hard of Hearing, and I have a letter here from our coalition that is in support of this bill that I would like to present to you today.
Furthermore, I'm here to represent not only myself, but my 4-year-old deaf son, who also wears hearing aids. Additionally, my mother, 2 sisters, and younger brother all utilize hearing aids. Within my intended family, we have 3 nephews who wear hearing aids and have cochlear implants. Personally, I have relied on these devices all my life. It is crucial to acknowledge that this bill, if passed, will continue to forward my children, my sister's 3 young boys, and our community members the opportunity to access hearing technology without encountering financial burdens, particularly those in underserved communities. By endorsing these 2 bills, we will empower the insurance industry to remove any financial barrier, obstacle, and to enable our children to hear without hindrance. Thank you for your time.
I'd like to thank all of you for your presentations. Thank you very much. Now I'll read in the cards. Casey Peller, not wishing to speak but supports the bill. She's from the Detroit Disability Power and Policy Manager. Jeffrey Einstein Hearing Association supports the bill and not wishing to speak. Dan Serafinoff, he's from the Alexander Graham Bell Association for the Deaf and Hearing, Hard of Hearing, not wishing to speak and supports the bill. I think I mentioned Casey Peller once, yes. Dr. Corey Casey.
Dr. Casey Stash and Dr. Kelsey Conrad.
Okay, Dr. Casey Stash and Dr. Chelsea Conrad of Michigan Audiology Coalition, not wishing to speak and supports the bill. Don Ketchinger, Michigan Nurses Association, not wishing to speak and also supports the bill. And Nancy Asher, just Nancy, not wishing to speak and supports the bill. Thank you very much, everyone. Okay. Were there any questions before I guess not. We're going to move right along. Thank you. So last on our agenda today is was somebody via Zoom? Okay. Are we good? Thank you. Last on the agenda is a presentation by the Coalition Protecting Auto No Fault, or CPAN for short. Before our guests come forward, my husband, Randy Carter, and I would like to share a brief personal story about our sons, Brian and Christopher, who died of traumatic brain injuries. The committee will go at ease.
The Committee on Insurance and Financial Services will come to order. Thank you, Madam Chair and Mr. Carter, for offering to share your personal story. The floor is yours.
Good morning, Mr. Chair, committee members, and guests.
Hit the button. There you go.
Good morning, Mr. Chair, committee members, and guests. My name is Randy Carter. I am the father of Christopher Carter. Today, my wife and I will give testimony about what we are experiencing after losing 2 children from traumatic brain injuries. On October 4th, 2011, Christopher lost control of his motorcycle. For 8 days, his brain swelled. My wife and I watched until he took his last breath. Our son, Christopher, survived his closed head traumatic brain injury and multiple organ failures until October the 11th, 2021. Then he died.
We were at the Congressional Black Caucus when we received a call at 4 a.m. in the morning. All I could hear was his fiance say, "He's gone, he's gone." Our lives changed forever when we finally realized that my only child perished from a brain injury. Brian Canty, do we have the other picture so we can see him? Well, I have to, okay, hold on. How do you scroll down? Thank you. There you go. Brian Canty died on September 14th, 2019. Ironically, his brother, Christopher, was born on that day. Every year, we remember our sons' lives and their death. These brothers who were taken away by traumatic brain injuries, even now we share the pain of losing our sons. We want you to know, Mr. Chair and committee members, that we both really understand the testimonies that are going to be given here today. We thank you for allowing us to speak.
Thank you both for your story. I appreciate that. The committee is going to go at ease and call the chair.
Excuse me, give me a minute. Thank you. Okay. Where are we? The Committee of Insurance and Financial Services shall now come back to order. I would like to turn things now over to CPAN. Here today, Tom Judd, Executive Director of the Michigan Brain Injury Provider Council, Bob, what are these names? Bob, I think you could pronounce your name with an M. Yes, come up. Co-owner of the First Call Home Healthcare based in Clinton Township. Shalise Wilson of We Can't Wait, and who is a personal guardian and caregiver for her brother who was injured in an auto accident. And Tammy Hanna, President and CEO of Origami Rehabilitation. Due to time constraints, we will have no more than 20 minutes for this presentation and 10 minutes for questions from members. Members, if we are unable to get your questions answered, please feel free to reach out to my office or to the stakeholders for questions after committee. Now, thank you for being here. I really appreciate it. The floor is yours.
Thank you, Chair. First, thank you for sharing your personal story. I'm sure that was very difficult and impactful, so thank you. My name is Tom Judd. I'm the Executive Director with the Michigan Brain Injury Provider Council. We're a proud founding member of CPAN and have been the lead organization within the Coalition on the Crisis in Care because our members and the people they serve have been most impacted by the fee cap systems of the no-fault reform law. And we stand united with family caregivers and crash survivors. I'm joined by my colleagues Bob Monarek, Tammy Hanna, and Shalise Wilson. Before we start this important presentation, I wanted to thank you, Chair Carter, for this opportunity. For over 2 years, advocates have been waiting for an opportunity to present to this body and present the devastating impact of specific elements of the no-fault law. We have been denied such hearings in the past legislative sessions, so we genuinely appreciate this opportunity and your leadership. Chair Carter and committee members, our hope is that at the conclusion of this presentation, you will walk out of this room with the common understanding that urgent action is required to end the crisis in care. Solutions are available. This is about ending suffering and ensuring consumers making informed choices get the benefits they signed up for in the unfortunate circumstance that their loved ones experience a catastrophic car crash. With that, I'll start by defining the problem, and for time purposes, I'm going to breeze through some of this, so I apologize. Some of this stuff might be old news to many of you here, but I just want to give a foundation of the problems. The first being the fee cap system. In 2019, we're really going to focus on this right-hand column, services without payable Medicare codes. And there's a host of reasons why Medicare might not cover services. In this discussion, it's because Medicare is not designed to provide services and care for people catastrophically injured, maybe at a very young age and needing long-term care. So in 2019, the law capped these reimbursements for these services at a percentage of the provider's 2019 charges. It started at 55%. Throughout this presentation, we're going to use that 55% because that's where we started. That's what is common language. But actually, what we now see is that it's 52.5% of what they were being charged in 2019. So Bob and Tammy and Shalise are going to talk more on a direct perspective of that impact. But just kind of wrap your brain around the fact that it's nearly a 50% cut in revenue. The other aspects of the crisis in care include the personal caregiver hours, or as it's commonly called, family provided attendant care. Before 2019, families and loved ones and patients could work with their physician, develop a care plan, and decide together how many hours that family could provide, or were willing to provide, or in some cases needed to provide because there was no other alternatives. And a physician oversaw that care, had oversight of the care, making sure it was appropriate and necessary. In 2019, the law slashed that to 56 hours per week arbitrarily. And that's for a full unit. That's not for one individual. That's for a full family unit. And then the utilization review process. Again, what we're seeing is people being cut off from services, and through the process, inappropriate standards of care being applied to catastrophically injured patients with severe brain injury, spinal cord. And so that adds fuel to the fire in terms of the crisis to care, in terms of denying necessary services. I'm not going to go into deep on this slide because Bob and Tammy and Shalise, but these are essential, and it's about 90% of the post-acute continuum that we represent here have these services that have no Medicare codes. So a host of services that are essential to getting people back into their community, back to work, or, if needed, long-term care in a specialized community-based setting or in their own home. So I'm going to just talk about the impact of the law through the lens of data. Prior to the implementation of the fee cap system in July 2021, we urged the legislature to do something proactively so we didn't see the devastation that we knew was going to happen. We were told by the legislative leadership at that time that we needed to see data. Well, we implored them. Those data points were people's lives and livelihoods. They were opportunities at recovery and rehabilitation. We were set aside. And so the fee cap system was implemented. And so we did get some data through MPHI, who this body, this legislature, uses quite often as objective, nonpartisan research experts. And what they found through a series of surveys was, as of October 20th, 2021, now that's less than 6 months of the implementation of the fee cap system, we saw over 1,500 discharges, 3,000 jobs eliminated, and over 20 companies having to close their doors completely. In phase 2, they did another survey in May of 2022. Now, this is not even a year post-implementation. What did we see? Thousands of more discharges, thousands of more jobs lost, more companies closing their doors, and even more having to cut their resources significantly, having to be very critical about who they can accept, deny patients, and hold on for dear life, hoping for some sort of relief, either through the courts or through a legislative solution. And then finally, and most tragically, and I hate to put this on a slide that includes data, but that's kind of the lens we're looking at it, tragically, we know of 15 confirmed deaths. And what we mean by confirmed deaths is family members, physicians, or case managers reached out to someone in our coalition, whether it be the Interfaith Coalition, We Can't Wait, or CPAN, and said we can attest to the fact that our loved one lost their lives unnecessarily because their access to care was ripped away. That's 15 people we know of. I can imagine there are many more souls out there that didn't have a voice to tell their story. I'll breeze through this quickly. The media has been covering this for the last 2.5 years because they see it for what it is, a humanitarian crisis. They have covered the story. They have told stories, over 1,200 stories in every media market throughout the state and every outlet. So anyone who says they're not aware of this crisis in care must not be in tune with their local media. But they have covered it because, again, they see what this is. This is about people's lives. This is about an injustice. And I'm going to not do service because of time constraints to the people here, but these are stories of people who have been highlighted in the media. I'm sure all of you are aware of Brian Woodward, who tragically passed away this past July. Brian was a hero. He was living independently prior to 2019. He was working productively, but he needed 24/7 care. to be able to do that, to live that life of dignity and productivity and quality of life. His care was ripped away because the care providers could not come to his home anymore because the reimbursement level was less than the cost of care. So Brian was hospitalized, rehospitalized, sent to different placements, and ultimately he just couldn't go on anymore, and his body gave out tragically. Kelly Miller also lived independently in her home. She was productive. Again, her care providers could not come to their home anymore after the implementation of the FECAP system. She was hospitalized unnecessarily, utilizing an ICU bed because there was no place else for her to go. She could not be independent. Courtney is also a great success story, and media shine light on Courtney and other success stories showing what we have lost. Courtney was able to get back to school and have a productive life because of the rehab and care that she was afforded, that others who are injured every day right now are not going to be afforded. And then I'm sure many of you have met Annabelle and her mom, Brandy. They are staunch advocates. They have been to Lansing several times telling their story of the difficulties that Brandy has had in terms of finding adequate care and scrambling for care every day for her daughter, Annabelle, who was injured after the law took place. Note, they bought unlimited lifetime benefits, right? Expecting to not have these kind of problems. They made that choice for their family, and the system has let them down. I'm not going to go line by line through here, but what I wanted to point out, you have this in front of you. These are state and federal disability advocates who have lent their voice to it. It's out of our little no-fault world. These are disability advocates who have seen this for what it is. It's a crisis in care. It's an injustice, and they lent their voice, saying we need urgent action. They have lent their voice from day one because they see what this is, and its devastating impact. With that, I'm going to turn it over to Bob, Tammy, and Shalise, who will give some direct perspectives. I'm sorry, guys, if I ate up some time. So, Bob, why don't you get us started?
Thank you. Please speak in the mic. Thank you.
Thank you, Madam Chair, and I'm very sorry for your loss. My name is Bob Milnerick. I'm with First Call Home Health Care. We operate out of Clinton Township, Michigan, and service all of southeastern Michigan. We provide Medicare services, private pay, many insurances, and auto catastrophic. I wanted to explain the levels of our care and what we do. Once a patient is catastrophically injured and goes through the acute system, they end up usually at home with their family or in a residential setting, and we can provide care for them. We have 3 levels of care depending on the acuity of the patient for an aid, level 1, level 2, and level 3. And of course, we also, for the highly injured, we provide skilled therapy and nursing. We provide basically 10 service codes, none of which are covered by Medicare long-term. If you take a look at this ChargeMaster, this is our 2019 ChargeMaster. And I'd like to also note that when the law passed, our company and many others didn't even know what a ChargeMaster was. Because they cut our reimbursements by 50% of our ChargeMaster. We didn't have a ChargeMaster, we had a rate sheet. We charged what we needed to charge in order to make a profit and provide the services that we have. As you can see here, our 2019 reimbursement rate or charge rate was cut by 45%, and the numbers in blue show our current reimbursements for those services. Each one of those reimbursements is below the basic cost of even providing 1 hour of care for the aid. So anybody injured after 2019, it's impossible for us to provide care for them. I'll dive into just one of those codes, our basic home health aid. And again, our 2019 reimbursement charge was $28. Of course, within 4 years inflation, it would be much higher at this point, but we are being reimbursed $15.40. So when we get a call from an adjuster or an insurance company, and we got many referrals from insurance companies because our rates were fair and reasonable, direct from insurance companies, we now get $15.40, and it costs $18 or $19 just for the base wage to send an aide there. And that does not include any of the additional overhead that a 24/7 operation might take. We need a legislative fix now. You know, for 3 years, I've been coming to Lansing and talking with many legislators individually, and I don't want to pick out this particular committee because many of you had nothing to do with this back in 2019. But I spent 20 years at the fire department in Harrison Township. I was a professional firefighter paramedic, and I seen a lot of things in my day. I've had babies die in my arms. I've had teenagers burned alive while I try to cut them out of the car. I've seen a lot of things. But I have never seen anything like what I've seen the last 4 years of a complete disregard for human dignity and life. How many wheelchairs do we need to bring to Lansing? How many companies need to close? How many paraplegics need to fall out of bed and lie in their own feces all night until the morning aid comes because no one was there at night? How many? It's been 4 years. We told everyone this was going to happen. We've watched it happen. And still, we are powerless to a very, very large, powerful group. It's been 4 years. Enough is enough. Thank you.
Thanks, Bob. Tammy?
Good morning. Thank you for this opportunity to speak before you this morning. My name is Tammy Hanna. I serve as the president and CEO at Origami Rehabilitation, which is a 501c3 nonprofit organization that has been serving the Mid-Michigan area for the past 26 years through our residential and outpatient programs. Origami's residential program is an accredited facility specializing in post-acute brain and spinal cord rehab. We provide 24/7 supervision, medical and behavioral intervention, and skilled therapy services for individuals who most often transition to us from the hospital. Our primary goal in the residential program is we aim to facilitate a swift and successful return to the community. The 2019 auto no-fault reform introduced significant challenges for accessing care due to the inadequate reimbursement rates that fail to cover the cost of specialized residential services. This financial shortfall has unfortunately forced us to turn away a staggering number of auto accident survivors with needs we used to be able to treat and achieve great outcomes. So far this year, we've regretfully had to decline 27 individuals in need of our residential program with complex medical, behavioral, and/or cognitive needs. And these decisions are directly related to insufficient reimbursement needed to cover the cost and allocate the necessary resources to provide the care to keep them safe. And this is all despite these 27 individuals in particular all had unlimited PIP coverage. Despite all efforts taken, Origami's been unable to bridge the gap between low reimbursement rates and the actual cost of necessary care. And as you can imagine, the financial strain on our nonprofit organization has been immense. Prior to the 2021 reimbursement cuts, Origami's 5-year average net margin was approximately 10%. In 2021, after we restructured as much as we could, reduced as much operational expense as possible, we ended the year with a negative 14% margin. In 2022, the loss increased to negative 30% margin. And in 2023, year to date, you can imagine also that we're on track for another financial loss. These figures are not just numbers. They represent lives impacted, opportunities lost, and communities in distress. And while the data is certainly important, I think we can all agree that the impact on human lives cannot be disregarded. Very quickly, I just want to share a brief story. Carter, once a vibrant 20-year-old, endured a devastating rollover accident. It left him with life-altering injuries, a traumatic brain injury, a spinal cord injury, and severe burns that covered the extent of his body. Despite tremendous efforts at Origami's residential program, where he was making progress in his recovery in hopes to be able to return home,
Funding cuts forced his transfer to a skilled nursing facility. Since then, Carter's life has spiraled into despair. He battles depression, exhibits behavioral issues, and he has lost his sense of purpose. And his mom insists that her now 22-year-old son, who resides in a skilled nursing facility, needs a rehabilitative environment so he can regain a sense of purpose. In conclusion, I ask that this committee recognize the urgency of this crisis in care. Post-acute residential providers like Origami need fair and sustainable rates to serve people who have been catastrophically injured. And with your support, we can continue our vital mission of providing accessible and adequate health care for Michigan survivors. Thank you for your time and attention to this.
Thank you, Tammy. Shalise.
Thank you, Representative Carter and members of the committee. I appreciate your time and attention to this very important matter. I apologize. My name is Shalise Wilson. I'm the sister, guardian, and personal caregiver to my brother, Clarence Golden, who was injured in an automobile accident in 2008. Both my mom and my brother were injured in this auto accident. My mom sustained a brain injury, but she's since recovered due to the care and treatment she received under auto no fault and is pretty independent. My brother, on the other hand, sustained a spinal cord injury, so he has a C2, C3 spinal cord injury, better known as a quadriplegic. He does not have any function of his extremities, arms or legs. So he relies on other people 24 hours a day for everything that he needs, from eating to breathing, because he requires a ventilator, to getting up, being turned. All of these things are required 24 hours a day. I'm so sorry for your loss, Representative Carter. I have one son. And that is exactly why I'm here today, because I've already experienced the heartache and the pain and the suffering that comes along with a catastrophic auto accident. These are not bumps and bruises. These are lifelong injuries where people, because God didn't take them away, I'm sorry, but they were left here. And because they're still here, we can't just forget about them. And in 2021, the reform took place. When I heard the news, my heart sank. But in 2021, it was like reliving the accident all over again. Because as they've mentioned, we create a plan, we create a regimen that fulfills the need of that individual. Is not the same across the board. It's not the same. So for them to dump us all in one bucket, and I know some of you may be wondering, my brother was injured in 2008, so we are supposed to be protected by the Andary case. But I get in my car every single day, and all of you do too. And I'm still choosing unlimited coverage because there aren't any other options in my mind. And I'm paying for the coverage, and if something happens to me on the way home from here, I know that the coverage does not exist. When the law changed, or when the fee cuts went into place, we lost the care agency that we had had since 2008. We lost nurses that had been with us for decades, for a decade. And that disrupted Clarence's plan of care, which causes him to suffer. And from a family perspective, and I understand there's a lot of questions about family care, but when Clarence was injured in April of 2008, and I'll try to make this quick, he went to rehab at Craig Hospital, where they embraced the family. We were a part of the team, so we were trained on how to take care of Clarence once he left their facility. He has a suprapubic catheter, he has an ostomy bag, he has a trach, he requires turning, he has to be transferred. Everyone does not know how to do that. So consistency is key for their survival, for their well-being. And at the end of the day, it's better for them, and it's helpful for the insurance company because the people stay healthy. They're at home, they're safe, they're not in and out of the hospital, which costs even more money. So I've provided a lot of information to you about why family is important, why they need to be there. I didn't choose to be a caregiver. I have a bachelor's degree. I worked full-time at the time of the accident. Caregiving was not in my perspective of things, but this is where God put me. And so I'm here to advocate for not just me, but all of you, anyone that has children, riding in the car, everyone, because we pay for the care. We've been paying for the care. My dad paid for the care all of his life till he was 80 years old, and he didn't ever get in an accident. So it's only fair that people receive. That is why we buy insurance, is for the peace of mind and the protection. So in the event we experience a loss, then we have that peace of mind. And unfortunately, PA 21 and 22 stole that peace of mind. I appreciate your time.
Thank you, Shalise. If I may, real quick, we don't want to leave the room without talking about solutions, because there are solutions out there. For the last couple of years, our efforts have been mischaracterized as wanting to go back to pre-2019. We do not want to go back. We want to move forward with a reasonable fee schedule.
Okay, I'm sorry, I was just checking legitimate process.
Okay.
Please continue.
Yeah, so we do not want to go back, turn back to the way things were. We recognize the intent of the law, and we want to meet that intent of the law. And there's a way to do that through a reasonable fee schedule that brings consistency, predictability, reliability to the system, get rid of needless litigation, let businesses like Tammy and Bob and Shalise get back to work and get back to their mission. Last week I heard someone use the word, the intent of the law was to normalize the system. Yes, absolutely. So let's do that with a reasonable fee schedule for these post-acute essential services. Let's also increase the eligibility reimbursement hours for personal caregivers. Get back to families and physicians making choices, all right? Not arbitrary limits put on by the legislature. Let's let the family respect their autonomy, their choice, and sometimes they don't have a choice, so let's make sure they have the flexibility to provide the care that they need. And let's enhance the utilization review process to make sure, again, not get rid of the utilization review process, but enhance it and ensure appropriate standards of care are being utilized at all stages of the process, and make sure that the process is congruent with the law in terms of reasonably necessary care products and services for the care and rehabilitation of people injured. With that, I sped through that. There's much more. I'd be happy to meet with every one of you individually to talk about this some more, but out of sake of time, one more time I wanted to thank you directly and personally. Again, we've been waiting for this opportunity to speak to this body, so thank you for the opportunity and leadership, and at your will, we'll welcome some questions.
And I do believe we do have some questions, and I'm sorry that we had a time constraint here, but your information was very important for this committee to hear. You know, we like to see the whole picture, not just part of the picture. That's why you're here. I really appreciate that, and we are looking for solutions, pretty much in line with what you're saying, to make sure that we don't revisit this again in 2 years.
Absolutely. Sustainable system.
Sustainable
Thank you.
system. So with that, I'm going to open it up to questions, and we have quite a few. Representative Breen.
Thank you, Chair Carter. Thank you to the people that are testifying, and I've interacted with many of you. Bob, thank you for all you've done, especially in your prior life as a firefighter. And as many of you know, I practice auto no-fault, both plaintiff and defense, in my prior life. So I'm going to keep my questions brief, limited to the providers, and in as much as I can, a yes or no format. The 45% broad-based cut for home health care services, were any other categories of medical services or treatments subject to that?
Only the non-Medicare payable amounts.
Okay.
The services that did not have Medicare equivalent codes.
And were the post-acute care home health providers at the table for these negotiations, or did you have any say in how this would affect your business or your patients?
I was not part of the process back in 2019, but I am told that there was no testimony, there was no professional expertise or testimony regarding the cut.
And if these, the 2019 law is based upon the 2019 charge master, wouldn't this mean that for providers that were charging the highest amounts suffered the least, but those that were charging lower or more reasonable charges were forced out of business?
Correct. There were some companies that had higher charge rates that they would negotiate down, that they ended up with a higher reimbursement amount than us. But the vast majority of providers in our field didn't inflate their charge master. They charged what they had to charge in order to provide the services. And if your charges were high, then you would not get in referrals from insurance companies or case managers.
Last bit here, if for those of us that are paying for unlimited medical, are there any guarantees that should we survive a catastrophic accident that we would have these services available and actually provided to us if we were to survive?
The way that I describe that is, the same as collision on your car. An insurance company might say, we cover your car 100%. And if you get into an accident, we will make it right. However, go find a body shop that works for $15 an hour. It's impossible.
Thank
Can
you.
I interject there? I'm sorry, but I just want to answer your question. The answer is no, because when the law changed, as I mentioned, we lost the home care agency that we had, and between the case manager and I, we called over 40 companies in and around Michigan seeking assistance for my brother, and the answer was no.
I was also at a recent conference, and there was a lot of case managers there that handle auto patients, and the case managers were going around to all the home care companies with files of post-2019 people that were injured that bought unlimited, trying to find a place for them, and they couldn't find anyone. We turned down 3 or 4 patients a week. In July, we had 1 week where we turned down over 10.
Representative Breen, I'm sorry, can you take the remaining questions after committee?
I'm done. Thank you,
Okay,
Chair.
thank you so much. Representative Grant.
Thank you. Thank you all for being here. And I will just say that my family has been through a lot of these things. So I appreciate you being here and speaking for people who are unable to be here and speak for themselves. Okay, so I have 2 questions. First is, you mentioned inappropriate standards when we're looking at utilization review. Can you tell me what you mean by that?
Yeah, absolutely. So I've done a review of DIFS orders related to utilization review, about 500 of them. And every single one of them, the insurance company in their initial rejection, if they use any standards whatsoever to justify that rejection or denial, they use 2 standards: the Academy of Occupational Medicine and ODG, or Official Disability Guidelines. These are typically used in workers' compensation claims. And so you might see a broken leg, and they see PT, they look it up and say, okay, a broken leg, you should have 8 visits in 30 days. They don't take into account comorbidities, a brain injury, and how that might impact that broken leg. And they certainly don't take into consideration long-term maintenance care for people catastrophically injured, so they're not rehospitalized if they don't have the services, if they don't decondition. So they are applying these standards universally, every single one of their reviews. If they cite something, they cite one or both of those standards that are primarily for workers' comp. They are not appropriate for catastrophically injured patients.
I'd like to add to that, as a home care provider, for utilization review, how it works is the insurance company decides to do a utilization review to determine if the care is necessary. They do not notify us immediately. We could spend a month or 2 continuing care for the patient and not knowing that they have started a UR and have cut off payments, and they stop all payments regarding the UR until it's settled. So in their world, it is you are guilty until you are proven innocent. We ended up paying for that care the entire time. And the patient often doesn't even know until months later either. And they do not resume care until after resume payment until after the utilization review process is there. And oftentimes it's not peer-to-peer. The patient's PM and our doctors are often not involved.
Thank you. I'm sorry, that was a lot to take in. Okay, so one of the things that was said about why reform happened was because there were bad actors in the space who may have been taking advantage of, just over usage of certain services. But you provide different levels and different services. Who actually decides what services a patient needs, how many hours they need it for?
Their physician. They're the physician that oversees their care.
Okay, so if the physician says that, how does that conversation go if the insurance company is saying there's overuse of care and the physician is saying what they need? Who decides the difference between those two opinions?
There's a lot of options. Now, after the reform, there's the utilization review process that we just talked about. They can still send them to what they term as independent medical examinations, IMEs. What they really are these third-party physicians that are hired by insurance companies to do these reviews, and sometimes they don't even see the patient. They just do a record review and then they make a statement. So it's on the provider and family to fight back against that, and oftentimes it could end in litigation. So there's many avenues to that providers and patients might need to go and battle for their care.
Thank you. I'll take my other questions offline.
Thank you, Rep. Grant. We only have time for one more question, and these are very important questions. So, Representative Young.
Thank you, Madam Chair. Thank you all for your presentation today, for your personal testimonies. These things, sometimes you got to put a face to it, right? You can look at all these figures and all of that, but it really doesn't tell the full story. And so when I look at these narrow solutions to end the crisis in care, what happens if we don't adopt these narrow solutions?
Well, then we disregard people's lives. Then we are making a conscious effort as a state, as elected officials, to turn our back on our citizens who need us the most. People with lifelong injuries, disabilities. If we don't do something quickly, we are turning our back. Every day there are 3 people injured in a car crash that will need long-term care. About 1,000 people a year. Those people are often young and have the rest of their lives in front of them. They will go to a nursing home and sit and look out the window at pavement, or they will be at home and have real jeopardy, not only to themselves, but to their community if they don't have the proper supervision and support. So if we don't do anything, then those 15 deaths that we talked about, those will continue. And those that we talked about, discharges and jobs lost, those will continue. And people who are making informed decisions. So this legislature valued personal choice in the auto no-fault reform law. They valued people making a choice. So people making a choice for unlimited benefits and paying their premiums, paying their MCCA fee, whatever it may be, they're making an informed choice. If we do nothing, that choice is irrelevant because they will not have access to the services that they think they are signing up for.
In addition, the MCCA fee is about $122 right now. It's likely that if the bill is passed, that will go up about $40. However, if we don't, that money that service is just transferred to the taxpayers under Medicaid.
Okay, I have to quickly thank everyone.
Thank
this
you,
has
Chair.
been extremely informative, and I encourage my colleagues on the committee to reach out To CPAN, thank you for coming here today. And just know this is a personal note for the chair, from the chair.
We appreciate you and we appreciate this opportunity. Thank you.
You're very welcome. Okay, we need a motion to excuse Representative Aragona and Representative Bruck from committee meeting today. Minority Vice Chair Harris moves to excuse Representative Aragona and Representative Bruck from committee meeting. Hearing no objections, Representative Aragona, Representative Bruck are excused. Seeing no more business before committee, we need a motion to adjourn. Rep. Young said it again. Rep. Young, Rep. Young moves to adjourn. And hearing no objections, we are adjourned.